Video Lecture, Chapter 19, Part 2. CDC and OSHA and Infection Control. Federal agencies that play important roles in infection control for dentistry. The Center for Disease Control and Prevention, CDC, the Occupational Safety and Health Administration, or OSHA. The CDC is not a regulatory agency. Issues specific recommendations based on sound scientific evidence on health-related matters. Establish a standard of care for the dental profession. OSHA is a regulatory agency and issues specific standards to protect the health of employees in the U.S. In 1991, based on CDC guidelines, OSHA based on bloodborne pathogen standard. Guidelines for infection control in dental healthcare settings. Released in December of 2003 by the CDC, new guidelines have explained upon the existing OSHA bloodborne pathogen standard and have included some areas that were not already covered. Guidelines are based on scientific evidence and are categorized by the basis of existing scientific data, theoretical rationale, and applicability. Guidelines apply to all paid or unpaid dental health professionals who might be occupationally exposed to blood and body fluids by direct contact or through contact with contaminated environmental surfaces, water, or air. The most important infection control law in dentistry, designed to protect employees against occupational exposure to bloodborne pathogens such as hepatitis B, hepatitis C, and HIV. Employers are required to protect their employees from exposure to blood and other potentially infectious materials in the workplace and to provide proper care to the employee if an exposure should occur. The BBP applies to any type of facility in which employees might be exposed to blood and or other body fluids, which include dental and medical offices, hospitals, funeral homes, emergency medical services, and nursing homes. OSHA requires that a copy of BBP be present in every dental office and clinic. Exposure Control Plan clearly describes how the office complies with the standard. Universal Precautions is referred to in the OSHA Bloodborne Pathogen Standard. Standard and Universal Precautions. Universal precautions is based on the concept that all human blood and body fluids, including saliva, are to be treated as if known to be infected with one of the bloodborne diseases, HPV, HCV, or HIV. The CDC explained the concept and changed the term to standard precautions. Standard precautions integrate and explains the elements of universal precautions into a standard of care designed to protect healthcare providers from pathogens that can be spread by blood and other body fluid, excretion, or secretion. It is not possible to identify those individuals who are infectious, so infection precautions are used for all healthcare personnel to their patients. Category of employees. The OSHA BBP standard requires employers to categorize tasks and procedures during which an employee might experience occupational exposure. BBP defines an occupational exposure as any reasonably anticipated skin, eye, mucous membrane contact, or percutaneous injury with blood or any other potentially infectious material. Post-exposure management. Accidents do happen. Before an accident occurs, the BBP requires the employer to have a written plan. This plan explains exactly what steps the employee must follow after the exposure incident occurs and the type of medical follow-up that will be provided to the employee at no charge. Employee training. The BBP standard requires that the dentist and employer to provide a training in infection control procedures and safety issues to all personnel who may come in contact with blood, saliva, or contaminated instruments or surfaces. The employer must keep records of all training sessions. The record must include the date of the session, the name of the presenter, the topic, and the names of all employees who attended. Hepatitis B immunization. OSHA requires the dentist to offer the hepatitis B virus HBV vaccination series to all employees whose jobs include Category 1 and Category 2 tasks. Vaccine must be offered within 10 days of employment. The dentist and employer must obtain proof from the physician who administered the vaccination. The employee has the right to refuse the HPV vaccine. However, the employee must sign an informed refusal form that is kept on file in the dental office. The vaccine is administered in a series of 3 injections. Most common vaccination scheduled is 0, 1, and 6 months. The preferred injection site is in the deltoid muscle on the arm. Post-vaccine testing. Between 1 and 2 months after the series has been completed, a blood test should be performed to ensure that the individual has developed immunity. Individuals who have not developed immunity should be evaluated by their physician to determine if they need an additional dose of HPV vaccine. Individuals who do not respond to the second 3-dose series of vaccine should be consulted regarding their susceptibility to HPV infection and precautions to take. Need for a booster. Routine booster doses of the HPV vaccine are not recommended by the CDC. The CDC does not recommend routine blood testing after the initial testing to determine initial immunity. To monitor the HPV antibody level in the individuals who have already had the vaccine. The exception to this recommendation is if an immune individual has a documented exposure incident and is attending physician orders administration of the booster dose. Employee medical records must be kept confidential medical records for each employee. These records are confidential and must be stored in a locked file. The employer must keep these records for 30 years. Managing contaminated sharps. Contaminated needles and other disposable sharps such as scalpel blades, orthodontic wires, and broken glass must be kept in a sharps container. The sharps container must be puncture resistant, closable, leak-proof, and color-coded or labeled with a biohazard label. Sharps containers must be located as close as possible to the place of immediate disposal. Do not cut, bend, or break the needles before disposal, and never attempt to remove a needle from a disposable syringe. Preventing needle sticks. Never recap used needles by both hands or any other technique that involves directing the point of a needle toward any part of the body. Always use the single-handed scoop technique or some type of safety device.